So for a broader perspective of the COVID-19 response in Imo State, Professor Maurice, the chairman of the State COVID-19 Task Force, joins us on the program this evening. He's also a professor of pharmacognosy. It's good to have you on the program, Prof. Well, from a general view now, how much would you say the security situation in Imo State has affected the COVID's response, not just vaccination alone this time around?
Yes, it has posed a special problem to the state, but just like Dr. Prosper said, we are taking the issue of the security first and foremost before considering the task force job of protecting Imo State against COVID-19. Luckily, we only have 2 active cases. I think they'll soon go off the clinic. We don't have any new cases coming in, and hopefully people are obeying the rules, but the security situation is really impeding the work we are doing. So far, so good. We have people at any given time, if there's any shots or any shout, they won't even know why people are running, people start running. But luckily, the state government is equal to the task. There are some normalcy now restored. People are going about their normal businesses, and it has not really affected the preparedness of the state to tackle the situations as they come. As I said, the curve is already flattened, but we are still urging people to obey those 3 non-pharmaceutical guidelines, namely to keep their face masks whenever they're in public or whenever they're outside their homes, or when they're receiving visitors. They should wear their face masks. They should wash their hands with soap and water, and if there's no soap and water, to use sanitizers. And much more importantly, because of what's happening in India, they should try to maintain social distance for people they don't know, because you don't know who has gone where. And that is actually the only area we have great concern is what happens when people travel from outside our state and outside our country to Nigeria. We don't know what they are carrying with them.
You know, I'm sure you've been watching the trends with vaccination supply in Nigeria. Well, we're not exactly sure when we'll get the next shipment from COVAX, or is it Pfizer or any other manufacturer. So, I mean, looking at the trends and what might possibly happen, don't forget the WHO says the target is 30% of the population by the end of the year. We're not sure when we'll get that next shipment. How do you see this playing out for Nigeria?
I think so far Nigeria is doing well. The NCDC and the primary health people are trying to meet to the target, and we are following up what they are doing. But what is very important, regardless of the vaccination, people should not let their guards down, because we don't know the strengths out there, whether the vaccines will be able to meet the challenge from those strains, the new strains that are coming up. So people should not let their guards down. But we are also lucky in this country that there's a whole lot of natural antibody being formed because of contact with the coronavirus. I think the level of antibody that is formed by contact, unknowingly having the contact with the virus, and the antibody studies that are going on is very encouraging, that a lot of people are building natural immunity to it, and then that will also help. The vaccination, I think, is going well. Since we don't manufacture it, we have to wait and get it from outside the country. I think this is a lesson for us now, that we have to be prepared, not to be dependent on other nations for such very vital things for healthcare, like vaccines and so on.
You know, while that conversation is ongoing, there's the talk about looking inwards as well. I know you're a champion of sorts for herbal remedies to COVID-19. If you could just give us an update. I know you've done some work, or you're doing some work. How is the clinical trial approval process generally of your formulation and others? How is it going? Because at some point you said that we could be faster with this process.
It could be faster. We are doing well. The trial that we are doing at the University of Lagos is proceeding well. It's coming to an end. But regardless of that, people are taking the preparations on their own, because once the NAFDAC approves a product for clinical trial, that means that it is at least good enough for human consumption. And that is what is happening, that people are taking the IHP detoxy on their own. But we even have a better good news. We have tested a known anti-malaria drug called artemisinin. We escalated the dose to 500 milligrams, and the result of a multinational clinical trial is very encouraging, that we can then look back and then think of reformulating a better strategy. Luckily, the study is being done concurrently in India, and we're also starting our own here in Nigeria, University of Abuja. We are waiting for NAFDAC to give us the nod. We have been corresponding with them. They raised some questions which we're answering. The entire thing is that this is a coronavirus. COVID-19 seems new, but coronavirus is not new. So we are trying to deploy the same tactical clinical method that was used for the other coronaviruses in the past for this particular virus. And we are better prepared now, and the product that we have worked, and then we don't have to be able to wait for other people to give us a treatment. And this is one big lesson we have learned, that it is good to have our research and development up and going, since we don't know what is out there. And in this particular case, the IHP detox is just a tea, but the other one that we are doing through the University of Abuja, which we have not started the clinical trials, we are going to start pretty soon. It's on an oral dosage form based on a drug called artemisinin, which is already in your anti-malaria product that you are using currently.
Well, Professor Maurice, it's been great speaking with you on this topic. Thank you so much for sharing your thoughts.
Thank you. It's a pleasure.